Good afternoon, ladies and gentlemen. We're going to have our webinar begin here in just a minute. I'm Steve Love, President, CEO of the Dallas-Fort Worth Hospital Council, and we want to thank you for joining us today for this very important educational webinar. It's hosted in coordination with BDM International, who is an associate member here at the Council. Today's topic is very pertinent. International patients during the World Cup, registration and collection. It's truly a hot topic, not only here in the DFW area, but also in Houston and in Kansas City and other places that are part of the FIFA World Cup. And so we can't thank you enough for participating. All of our hospitals here in the DFW area, and I know the ones in Houston and in Kansas City and other places, have been working very collaboratively for the last 18 to 24 months to get ready for emergency management, security, all the things that go with this event. But there's one thing that's very important, and that's for our international friends that may need medical services and hospital services, and how do we build that and recover that? BDM International specializes in healthcare billing and recovery, and they do work completely throughout the world, and they do an excellent job. Today, their topics are going to cover identifying international patient accounts, establishing best practices, extending the global reach of your billing, and implementing an international billing service. Now, no hospitals have had to deal with international bills throughout just being an acute care hospital. But you've got to realize this is going to be a large contingent of people from all over the world. We're so delighted that we've got Vice President of BDM International with us today. Her name is Jennifer Powles Johnson. She's been in healthcare consulting for over 22 plus years, and the last 19 years, she has exclusively dedicated her work to the revenue cycle. So we look forward to her presentation, and I do want to tell you, if you have questions, you can put them in the chat box. I know you can put them in the Q&A box, and we'll try to get to those at the end of the program.
So a couple of things I want to go through today is, first, what we're always going to have to talk about specifically with the World Cup is that you're going to have a certain profile of attendee. That attendee is going to be someone who is highly affluent. Specifically with the World Cup, it's very similar to hosting basically a Super Bowl. So what you have is a highly affluent population that's going to be able to come in and actually do this specific event. They have to be able to afford round-trip airfare into the US. They have to be able to afford hotels in the Dallas area specifically for you. And the Dallas area hotels are not planning on just charging the regular amount of money. There's all going to be a premium specifically on the hotels during this event because they know they can get that additional money. The other thing is they're going to need to be able to provide themselves with tickets to the event. Now, a few days ago, I went and I looked specifically at the event in Dallas, and those tickets are roughly running $900 for the minimum ticket that you can have to attend this event. So when you look at that conglomeration, you look at the folks that can afford to come to this event. These are highly affluent people. It's not people who are doing bake sales and scraping their dimes together in order to come to this event. And what that tells me from an international perspective is that this is a crowd that is highly collectible. The other thing that you need to be aware of, and I'm sure because of the folks that are tuning in on this event today, is this specific group is aware that American healthcare is a one-of-one situation. There is literally nowhere else in the world in which you are going to have this same type of situation where We have in America, you come into the ER, they look for your insurance, they run some sort of verification process, the normal domestic thing that happens when people come into the hospital. That system does not exist anywhere else in the world. If I have some sort of trouble, let's say in London, and I go to a hospital, the revenue cycle in London doesn't exist in the same way that it exists here. If I go to Mexico and I need to see a physician or go to the hospital in Mexico, they're going to want cash up front before they ever treat me for anything in that country. So with America, we're going to come in, we have our EMTALA rules, we're going to see you, we're going to treat you, we're going to stabilize you, but the revenue cycle is very, very different. So what tends to happen here is a couple of things. The first thing is when people leave your care and they get it back on a plane and they go home to their home country, a majority of them will never actually get a copy of their bill. And the reason for that is all your systems within your hospital are automated. So let's say you even got that address perfectly right on the bill and it went through to your vendor and the vendor printed off that bill. There's no one checking to see whether or not the postage to get that specific bill all the way to that country is even there to get it. So a majority of these folks are never going to get a copy of their bill. They don't understand that there's a charge for the hospital. There's a charge for the physician generally. There may be charge for the ambulance or emergency services that took them. So there's not a lot of understanding outside of the US about how our system works. So it's really, really important to be aware that they don't necessarily understand our system. And then the other thing is some of the questions that we could ask people when they come into the ER could feel, depending on which country you're from, kind of invasive, kind of a little like, oh, that's private information. I don't know if I want to share that. So a lot of times people will come across as a little offended, perhaps feeling like that was a little rude. And so it's really important that you get your patient access staff aware that there's going to be a cultural mismatch on some of this stuff. And that if the patient starts to act like, well, why do you want to know that information? Or is withholding of information, that doesn't necessarily mean they're trying to be difficult. They just don't understand the normal questions that we would need to ask here in America in order to provide that care. The other thing that I have been noticing while I've been working with different hospitals in Kansas and earlier this week I spent some time in Seattle. Everyone's got a little different approach about how they want to involve the embassy or the consulate. And so specifically in my Kansas area, Kansas City area, they've made a decision that they are going to actually reach out to the consulate and the embassies ahead of time. They're going to get a medical release form from the embassy and or the consulate, and they're going to provide that on the front end to that specific patient. So when they come in, should there be a need for that person to require additional care when they get back to their home country, that they're already kind of pre-working with that embassy or that consulate to be able to release that medical information. Now, there's a big caveat there because not everyone feels very comfortable doing that. So for them in the Kansas City area, they're using that as like an optional thing. Would you like us, depending on the level of trauma, if we need the help of your consulate or your embassy to be able to release that information to them. And then we've definitely trained the patient access staff in those areas to let them know if the patient pushes back on that. If they don't want, then that's a completely optional thing. And frankly, we hope that you never actually have to use those forms. And then the other thing that we need to be aware of is everyone on this call is probably using either Epic or Cerner. There may be some still McKesson shops out there, maybe some Meditech shops out there. The problem with American systems is they kind of make the assumption that everyone that walks in the door is going to be from America. So it's really important that you're having those conversations before people ever walk in the door about how are you going to capture, how are you going to flag this specific international player. patients so that they're not just automatically going through the domestic process. The other thing we've noticed is depending on the level of sophistication of your patient access staff, we as Americans, as people working on the front lines, automatically relate to that person that's coming in. And when they tell us they're from another country, our first thought is kind of put ourselves in their position and say to them, oh my goodness, this must be so scary for you. And then if I have somebody say from Japan, because I know you guys are hosting specifically Japan, and some from Japan comes in and I need to somehow capture their address in Japan in my Epic system or in my Cerner system, and I'm looking at an American keyboard and I'm thinking, how am I going to get that Japanese address into my American keyboard? What tends to happen if your staff isn't prepared is they're going to register that patient with the Marriott's address or an Airbnb or the Hilton. And that information, although it's great in that moment and it allows that person to go ahead and be seen by your facility, absolutely does nothing for you in terms of actually collecting on that patient once they've left your care. So it's really important to discuss how are we going to capture those things. And I'm going to walk you through some kind of best practices and ways that we could possibly do that and the ways that we teach other people to do that. So, and then last but not least, I think it's really important to have a conversation with your emergency room patient access staff and let them know, okay, these are the folks that are coming in for the World Cup. These are going to be affluent people because you can't afford to go to the World Cup unless you're affluent, and allow them to have that comfort of knowing that although this person may be scared and although this person is definitely in some sort of healthcare crisis, these are not people without means. So we don't need to make up a story about them and what their ability to pay is going to be. We just want to treat everyone like they're law-abiding citizens of the world and that everyone's doing their best and that they're willing to provide this information so somebody can follow them later and discuss their bill with them once everything is said and done. So when I talk specifically to different groups about how we're going to capture that information, how do we get Japanese addresses into American systems? What we generally recommend is a couple of different things. The first thing is the moment that patient comes in and we've identified that that person is from another country, perhaps what we're going to do is take a blank piece of paper. We're going to slide it across the table to that patient, and we're going to say to them, hey, listen, if you were going to send yourself a postcard home, how would you do that? And what that allows the patient to do is just fill out a postcard as if they were sending themselves a postcard home. That doesn't care about the keyboard we're working with. That doesn't care about the different nomenclatures or languages that you're going to want to see from that patient. All it does is allow them to send themselves something in a way that they would actually receive it. The other thing that I've seen a lot of my hospitals doing that are preparing for the World Cup is they're putting a flag in the system. And the flag just says, are you here for the World Cup? And what that's allowing those folks to do, and it's a simple fix, adding a little question in there, is it's a yes or it's a no question. So after your first weekend of hosting the World Cup, you then have the ability to look back at the last weekend and say, how many patients did we end up seeing there? And based on the countries that we were hosting in that specific game, how many actually made their way into our care? It's a simple flag, but it also takes that specific person and pulls them out of the domestic collection process and lets you identify that they are here as an international patient. So that's a simple little fix. The next thing is we're hoping we're doing that postcard, but we also need What's really important, and a lot of people don't realize this, is you need to be able to speak to that patient once they're out of your care and probably back in their home country. So having two different methods to get a hold of them would be very important. So the first thing is you're going to want a phone number and you're going to want it with the country code. Now, a lot of patient access folks have never called internationally. So they have no idea that when people come in from another country, they're going to have a phone number, but that's also maybe not going to be the same digits as the one in US. And they're going to need a country code. So they don't know that they're supposed to be on the lookout for a country code. So talking to your patient access staff, making sure they're trained on knowing that that is something you need to capture. And then if your system will not accommodate that number, let's add that to the postcard that they were filling out. The second way we like to get a hold of people, and it might be easier for everyone involved, is an email address. Now, this seems like a no-brainer, but in the US, we have a certain nomenclature for our email addresses, and everyone else throughout the world has a different nomenclature. So if I am sending an email to even a Gmail account in the United Kingdom, it's going to be at gmail.co for country, and then it's going to be .the country extension. So specifically in the case of the UK, it would be at gmail.co for country, .uk for United Kingdom. If I was sending an email to Japan, it would be at co.jp for Japan. That's another thing the patient access staff needs to be aware of, that there's going to be emails that are coming in that have a different nomenclature than they're used to. Additionally on that, dates internationally are different than dates in America. In America, we're always going month, day, year. Everywhere else in the world, they're going day, month, year. If I'm doing that way and anything's 12 and under, what the patient may be telling me and what I'm hearing from a registration standpoint could be completely different things. So if someone says, when's your birthday? And that person says 9/12, your staff's automatically going to think September 9th, when really they could be telling you the opposite. So just make sure they're aware of that. And then the last thing when it comes to, when we're talking about how we are going to make sure we have the ability to contact these folks after they've left your care, is everyone does a really, really good job at getting a copy of the passports. A copy of the passport, they do really good. The problem with the passport is it doesn't actually tell you a lot of information. So in my case, my name is Jennifer Powers Johnson, and I'm from America, is what it will tell you on my passport. And I was born in Montana, but that is the entire amount of information you're going to get from my passport. Now, because I hyphenate my name, I'm the only one in all of America. But if I didn't hyphenate my name, I would be Jennifer Johnson from America. There's over 10,000 Jennifer Johnsons in America. So what we always try to encourage our hospitals that we're working with and our physicians that we're working with is you want to get that additional piece of identification. You want to get a driver's license. You want to get a business card. You want to get a student ID card, because what that allows you to do is have an additional layer of specificity. And every country around their world has very generic names that are part of their culture. So everybody in the world has the Jennifer Johnsons of their country. So it's just really important to add that additional layer of specificity to see if you can't be able to track them down further should you need to pull in additional resources. The next thing I want to talk about is specifically international insurance. So The first thing that's really important, and of course we would love to help you, but any vendor that you work with or partner that you work with that is going to be able to work with international travel insurance or international self-pay patients is a lot of times you need to be able to reach out and have a conversation with that patient in their home language. So whatever partner you work with should have a lot of languages on staff so that they're not mailing things and hoping they're getting there versus calling that patient or emailing that patient and having a specific conversation. To give you an idea about that, you never really realize exactly how great the U.S. Postal Service is until you start working with the mail services in other countries. If I am sending something to, say, Chile, and I send that in the first week of a month, by the end of the second month, it'll usually be delivered. So if I send something today, I'm going to expect that somewhere mid-July, whatever I mail to them is going to get to them versus emails immediate. Calling on the phone is immediate. So it's really important for you to be able to have somebody on the phone call for that. The other thing is that there are a million different insurance companies around the world, a million. And the laws of the country in which that policy was issued are the governing laws of a policy. And we're going to talk a little bit more about that because I believe a majority of these patients will be highly insured simply because they know they're coming to the US, but their policies can be a little tricky. So if I have a policy that was issued, say, in Germany, German law states that if a patient files a claim or a provider files a claim on behalf of a German patient, it is illegal to pay the provider back in both Germany and Austria. So what they're always going to be doing in those cases, even if your team did a really good job, is they're going to be sending a check to the patient. So it's really important to be able to have somebody on staff that reaches out to that patient and says, I'm sorry your trip to the States wasn't the best, but you can't keep that money. We need to go ahead and move that money along specifically to the provider. So you just need to be aware that international travel insurance is very, very tricky. The other thing to be aware of is a lot of times, even if policy is issued by an American-owned insurance company. So we saw a big shift in the last few years in which American companies are actually going out and purchasing international travel insurance companies. And so although they're issuing those policies in other countries, it's still owned by an American company. However, that doesn't necessarily mean they're going to be printing those policies in English. So a lot of times what you will get, and when you get the presentation from us, you will see some copies of different versions of insurance that are actually really collectible. However, they're in completely other languages. So if they're in a language that is Latin based, a lot of times your team will be able to look and pick out words that will make sense. But if an entire policy has been issued in Arabic, or an entire policy has been issued in Japanese, and someone hands your patient access staff a copy of that policy, a lot of times what you'll see our patient access staffs do is look at that policy and not be able to read anything on it and have a level of discomfort about what do I do with this? And the person will decide, oh, I'm so sorry, we don't accept this insurance. And they'll end up handing back that policy to the patient. Now, does that mean all is lost and you can't collect on that? Absolutely not. But you're going to need to have someone who can reach out to that patient and get a copy of that policy. And then you're going to have a team that knows exactly how to interpret that policy and bill against that policy. So not every time is that going to be the case, but your patient access staff in the ER needs to know that sometimes documents will be presented to them that are not in English. We don't care what it says. We don't care what it looks like. You're going to want to take a copy of that document and make sure it's been scanned into the record. The other thing to be aware of is sometimes people have insurance that they are not aware that they have. And you say to yourself, well, how is that possible? Well, I do this for a living. I basically get paid to travel around the country and work with hospitals that see a lot of international patients. So a lot of business centers, a lot of ski resorts, a lot of beach resorts. My husband calls it my fake job because I kind of get paid to go places people want to go on vacation. I travel everywhere with 2 credit cards. I have my American Express card that I love because it gets me all my lounge access. However, I also travel with a Chase card. My Chase card has a yearly annual fee of $95. As a part of my yearly annual fee of $95, I get 2 policies associated with that. The first one is if I buy a ticket to another country, there's an automatic policy that follows me on that trip for $100,000 for medical care. Now, if I didn't have this job and I was just traveling around with my credit cards, I would have no idea I had that benefit because it's not like they're selling that benefit to me. They're selling something else. They want me to use the card for points. They want me to use the card for other reasons. But every year they'll send you an updated benefits form. It usually comes in that terms and conditions. And so it's that big, thick manual. And then I always say, people always ask me, how do I find out what my benefits are on my card? You can log into your American Express. You can log into your Chase. You can log into your Capital One and see what your international travel benefits are. Well, specifically for the World Cup, everyone is going to need to be able to book a ticket to America with a credit card because the days of being able to walk up to the counter and give them cash are over. So if they had to buy their plane ticket to the US with a credit card, and that credit card has a possible international travel benefit, a lot of times the patient will be insured and they won't know they're insured. But if no one calls them and reach out and says, hey, saw you went to the World Cup and you ended up in the care of XYZ hospital. What credit card you use to book that ticket? If no one's having those conversations, there's no way to actually ascertain whether or not that patient has insurance. The other way is a lot of times what will happen is the last thing you do when you are booking an airline flight is it'll say, do you want, check this box, yes or no, if you want to insure this trip. A lot of people are under the impression that that means if the trip gets canceled, then they will get a new trip. That's not what that is. That specific insurance that they're paying that extra $25 for or $40 for is specifically a travel insurance policy for medical care. So a lot of times they purchase that thinking it is for one thing when in fact it's for another thing entirely. So that's something to be aware of as well. But again, you're going to want to have a partner or a team that can follow up with that patient and realize that these are the conversations we need to be having to be able to uncover insurance. Our experiences of the patients that come in nationwide, who come in as self-pay patients, roughly 60% of them, depending on how they came to the country, will have insurance that sometimes they are not aware of. The other thing to be aware of is, let's say they did purchase a policy and they knew they were coming to the US. Now, My oldest son is married to a gal from Scotland. And when they got married, her parents came over from Scotland. And the only media they had ever heard, they'd never been to America before, and their main media consumption was the BBC News. And if you know anything about the BBC News coverage, there's kind of two general themes. And one of the themes is in America, they don't have socialized medicine. Can you believe it? They can't get health care for free. So when they were coming over from Scotland, that was something that was very top of mind. They absolutely know they were coming to the US, and the fear was if anything happened that no one in America would treat them. So before ever even reaching out to me, they went ahead and secured that travel insurance. Depending on the country you're from, they are aware and will purchase that. But let's say for the sake of argument, they purchased a policy. The policy's great. It's in English. Your team can read that policy. What they're going to want to do, like everyone wants to do, is they want to put that insurance policy into the computer and have the computer do what the computer does, which is make a call to the insurance company and say, what's the eligibility? What's the copay? What is the co-insurance? All of that information. International policies do not have any electronic eligibility available. So that's another thing you kind of want to work about with your patient access staff with. They could put that policy in perfectly. They could pick everything. It could even be an American insurance company that had issued that policy, but in another country. And they will get no electronic information about what the eligibility is on that patient. A lot of people think this is some sort of bug in the system. It's not a bug, it's a feature. As an insurance company, the longer and more manual I can make this process, the longer the funds for that care stay in my bank account. So when you're dealing with domestic collections, you have a fair amount of time where you can go, okay, this is a domestic thing. This was the insurance. I'm probably going to get paid within sometimes as close as 15 days, but generally 30 to 60 days before I'm going to see that payment. Internationally, it's a much longer process. The average time it takes to collect on an international patient is roughly 6 months, but more likely 9 months and can go as long as 12 months. So it's really important to have that awareness. So when I look at that, I go, okay, from a revenue cycle perspective, how can I mitigate some of my risk, even if this is a patient that is insured and I think I'm going to be able to bill their insurance? Well, what I'm going to want to do is I'm going to want to collect a deposit up front, because $1 today is worth $1, but $1 6 months from now, that same dollar is worth about 80 cents on the dollar, right? So let's start talking to our staff and let's look at our staff and say, okay, when we're dealing with the World Cup and we have a bunch of people coming in from other countries, we might want to get a higher deposit than we would normally get on these encounters. So I have systems all over the country that are making preparations specifically for that and have reached out to me. And there's two things that I've advised them. The first one is if you're seeing international patients, you're definitely going to want to have some dialogue with your patient access team about how they're going to be asking specifically for money, right? And then you're going to want to increase those normally. So it'd be really hard to get in and out of a emergency room for under $1,000. So my recommendation for most people is that no matter what, you're asking for a point of service charge for $1,000. Now, I have hospitals in other parts that if that patient is admitted, they're asking for anywhere from $5,000 to $10,000 because that patient was admitted. And that has to be phrased as a deposit. So again, that is a really different conversation I would imagine that most people are not comfortable having. So do we have the right people in the ER during this time period that can have those difficult conversations? Is our financial counseling team in there, right? This is the other thing we want to think of. The other thing is on all international policies, the patient is always going to have to take some sort of action. So to give you kind of an idea, generally what will happen is let's say the patient comes in and they've got a United Healthcare insurance and your team reads it, it's in English, puts it in, they realize they're not getting any eligibility back on that specific patient. We go ahead and move along, but we've captured that insurance. What will generally happen is about 30 to 60 days down the road, whoever works your United Healthcare claims is going to get some sort of a work list item or something that they need to check on. And they'll say, you know what, we haven't heard anything on that claim. We should reach out to the insurance company and see how that claim is going. So what will then happen is that your person will reach out to their representative at United Healthcare, and that person will look up the claim and say, oh, great. Yep, we've got that claim right here. We've received everything we need from the hospital or from the physician. We're just waiting on one thing from the patient, and then we're going to go ahead and get that claim paid. The problem then becomes, who has reached out to the patient? Who has reached out to the patient, had that conversation, and said to them, okay, this is what you need to do, right? No one from the insurance company has done it. And depending on the skill set of your staff or your ability to speak that language or to reach out to them via email, no one's told the patient that the patient needs to do something. That's why it's really important to have a partner in this so that they know the laws of the country that specific policy was issued in and what the general laws are saying that the patient needed. Now, when you have a partner, the partner can reach out to United Healthcare and say, yes, I understand you're just waiting on one thing from the patient. What is that specific thing? And a lot of times it is something as simple as a copy of their plane ticket or a copy of their hotel bill to prove that, in fact, they were in the United States and did check into a hotel or did go on that flight, and they do need that care that was described there. Now, you're always going to have, at some point, some self-pay patients. My advice is, if they come in and they have no insurance, no one was able to ascertain insurance after the fact, there was no phantom credit card, there was no insurance that was being able to be built or found, that these are, again, very affluent people. So a couple of different things to be aware of. Number one, you need to be able to take credit cards. If someone does reach out to that patient and calls them in their home country, you need to be able to take credit cards. So a lot of times that can be a little tricky because in America, our credit card systems want to get the credit card physically. But if they don't have that, they'll take the credit card number, expiration date, the little CID code, but then they're always going to want that billing zip code. America has a certain zip code. Other countries, some countries don't have zip codes. Some countries have an alphanumeric zip code. So how is it that you are, like, do you have some dummy zip codes that you can use to force those payments through? And the other thing is, let's say for the sake of argument, that this is a patient that doesn't want to pay you by credit card. And what they want to do is give you a wire transfer. Is your banking staff aware that there's going to be incoming wire transfers? Do you have a service like Western Union in which you can send the patient a bill and that they will be able to wire transfer or use that Western Union in order to get that payment to you? Because the truth is, you don't want that payment in the currency of whatever country they're from. You want that payment in American dollars. So you got to make sure that your system is set up in order to take those self-pay payments if you need to in a way where you can receive wire transfers from another country, or you can receive Western Union or some sort of credit card payment. And they need to be aware that they need to pay you in American dollars as well. The only thing to kind of look out for there is generally if they're sending a wire transfer from their bank's probably going to charge them $15, $25 for that wire transfer. So having some flexibility about being able to write off that little charge so you can get the payment there. Last but not least, what I would say is I would highly recommend that you have registration sheets in the languages you're anticipating seeing. So if you have a bunch of folks coming in from Japan, it would be great if you had registration sheets in Japanese, because what that allows them to do is fill out that entire registration sheet, and then you've captured it in their home language. And then it's just going to be really, really important that you have the ability to translate that, reach out to that patient, and act on that information. So, because you can't guarantee that everyone that comes in the door is going to be able to speak English or understand that system. So we highly recommend having registration sheets in other languages when all else fails. Now, a majority of you will have interpreters or interpreter services via telephone or perhaps in person or via Skype. My daughter was actually a medical interpreter for many years. And one of the hardest things for her was, although she knew the revenue cycle system, she was disallowed from the interpreting service with providing insights and help on how to get those bills resolved or paid, or even financial counseling information. She just had to speak specifically about the healthcare that was happening. So I just really think I can't hammer home enough that you need to have some sort of partner that is able to provide that guidance in other languages as well. And with that, we are coming to an hour and 44 minutes. So I know they want to leave some time for questions. If anybody has any questions, I would be more than happy to answer those. And Chris, you probably have a better access to the chat. Actually, no, maybe I have access to the chat.
I've got it. This
Perfect.
is Steve. Yeah, I've got it. Hey, I've had people text me and everything.
Okay.
Here's the first thing. People really like the way you explained the email and when you're using international codes. Are there any things about international addresses where they write a postcard to themselves, so to speak? Any nuances or examples there you need to be on the lookout for?
That's a really good question. So you need to be aware that our naming system or our address system is uniquely American as well. I think Canada does it pretty similar as well. I've been to Canada a couple of times. I had parents that lived in England for 3 years. And when they lived there, we would rent a car, and I didn't even need their address. I just needed their zip code. And if I plugged their zip code in, it would take me directly to their house. But then I have another daughter that lived in Chile, and she lived there for 2 years. And I would send her, literally, it would be, there were 4 numbers in the whole thing, and it was Avenue of the blah, 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 blah. And again, it's not always going to be the same. And then each different country also has, like if I'm sending mail to, let's say, Morocco, and I mail that mail in January, and if for some reason I did not have the appropriate address, I won't find out that that mail didn't get there until August if I mailed it in January. So if the patient is actually writing themselves a postcard, you really do have that's best case chance of being able to send them something because they wrote their address in their nomenclature. And what the US does is we're going to take that whole mail and we're going to drop it off at that country's door, and then they're going to be delivering it. When the pandemic happened, there were literally countries all over the world that just suspended their mail service They just stopped. We would go and drop it. US would go and drop it at their borders, and went nowhere. And then I would say it took probably a full 2 years before a majority of those were restored. And there are still countries in which mail still can't be found. The other thing, just while I'm thinking about it, sanctions. You need to have a legal team who is very, very aware of which countries are currently under sanction. Because once those folks leave your care, let's take Russia, for example. Once somebody from Russia leaves your care and they go back to Russia, no one can get money out of Russia without breaking international law. So it's really important that your legal team is aware of who you can take money from and who you can't. The Iranian national team was going to be training in Tucson, Arizona. 2 days ago, they pulled out of Tucson, Arizona, because we're still at war with them, and they moved their entire training into the country of Mexico. But they are going to be competing in Seattle. So there are some nuances with that as well. I'm sorry, Stephen, you go ahead and ask me the next question.
Yeah, in fact, I think the Iranians are going to be in Houston.
Are they there
Yeah.
too?
Yeah. So that's a very good point. One of my public health friends sent me a note. It said, we're talking revenue cycle, but she said, if you're gathering local address and you're getting a postcard for their home address and you're getting emails, the hospital revenue cycle people may be prepared to share that with infectious disease people in the hospital. In the event, from a public health point of view, they have to be notified because of exposure to something. That's not a question, that's just a comment.
Definitely all hospital teams would have to check their legal department specifically for that and whether or not they could share that information. At the end of the day, I guess the upside of this is that although we want to be as compliant with regulations as possible, we mean Americans, right? The laws of privacy in every single country are completely different than the laws in America about that. And so if you're going to be compliant with US law first and foremost, is what I would say on that.
Right.
Yeah.
Okay.
Yeah.
Understood. And that's just a good point. Hopefully we won't have to deal with that.
Right. Yeah.
Here's a question we got, Jennifer. We work with large physician groups and they provide services at our hospital. Can we share some of this information that we take on patients with our physicians that have provided services?
I'm assuming that all of your physicians have rights at the hospital, have the ability to work with the hospital, and there's some sort of agreement regarding data, right? So when every patient comes into a hospital or into any physician office, they're given a little sheet at some point that says, please sign here. This gives us permission to treat you and bill your insurance on your behalf. Depending on the scope of that disclosure, I don't see any reason why an international patient would be any different than a domestic patient when it comes to sharing medical information to physicians that are providing them care. That should be standard regardless.
Okay, great. Can y'all hear me okay? Can you hear me okay, Jennifer?
I can hear you. It's a little staticky, but it's not crazy staticky.
Oh, okay. I'm not sure what's causing that. This any better?
Yeah, great.
That's better. Okay, good. Is there a process, if you know countries that are coming, like Japan, to determine travel insurance coverage benefits prior to treating patients?
There is not. And again, like I spoke about earlier, that is a system feature versus a system bug. I would say this, there's a couple of different things going on. With the regular insurance agency, also, they would have your medical records if you had been with them, like a domestic, would already know kind of your pre-existing conditions and all of this kind of stuff. International travel insurance is going to assume point every single time that it's a pre-existing condition. If someone comes in, falls and breaks their arm while they're at the game, the insurance is going to deny and say it was a pre-existing condition. We have found, and that's part of the reason why it takes 9 months to 12 months to do this, is because everything is an appeal. Everything is no, that wasn't pre-existing. Now, there will come a time, let's say you had a cardiac event in which you're trying to bill the insurance and the insurance is saying this was a pre-existing condition. If you don't have somebody working with the patient to get their prior medical records around the possibility that it was a pre-existing condition, then it's going to take longer because you are going to have to prove that it wasn't in those cases. Cancer is going to be a really tough one because a lot of times what will happen is desperate people will do desperate things and they will come to the US for something else, but maybe the country they're from doesn't have the top of the line care. And so we have had situations where people from other countries have basically Googled what the best hospital is, and they will go into the hospital with something that they know they've been diagnosed with. And the American hospital, oh my goodness, you have this cancer, let's start treating you. Those are very, very expensive drugs. So there's not a lot you can do. What you want to do is be able to, let's say you have a terminal patient, you want to move them back to their home country and in their home care as quickly as possible because US healthcare is so much more expensive than every other country in the world. So whatever care they're getting in the US is going to be at least 50 to 70% higher than that same care in their home country.
Got it. So can you hear me okay now? I just got another text saying my microphone was hard to hear. Can you hear me?
I can hear you.
Okay. This is kind of the final question to wrap it up. How do you identify international accounts that may be in your inventory because you incorrectly registered them as a domestic account? You have any tricks of the trade that you can suggest?
I do have a little trick of the trade. So very similar. We're specifically a collection and financial consultant agency where we specifically work with international patients. Domestic collection agencies, your regular collection agencies, are very much they're working on, they want to get through as many accounts and get as much money as they possibly can. So they're dialing for dollars all day, every day. And the second one of your domestic collection agencies identifies that this patient is not even a domestic patient, they may not tell you, but they've definitely taken it out of their rotation so that none of their collectors are churning and burning on that. So a lot of times what will happen is you can reach out to your regular domestic collection agencies and you can say to them, hey, listen, can you send me all the international accounts you've identified within your inventory that are mine? And they will return those happily back to you because they don't want to be responsible for those because they have no way to reach out and collect on those accounts. So they've taken them out of their process. So a lot of times, although you may look at your current inventory and go, oh, we don't have that much exposure, right? You can reach out to your domestic agency and they will absolutely return anything that they've identified as international. And the other thing I like to tell people is the second you concentrate on anything, you start to see that thing. So I liken it very similarly to buying a new car. You want to buy a new car, you're excited about your new car, you go down to the dealership, you pick out your new car, and as you're driving home, everyone on the road is driving your new car. You never noticed them before, but now you see them everywhere. The moment you train your patient access staff on how to accurately register an international patient and they're on the lookout for it, you're suddenly going to say to yourself, where do all these international patients come from? Because now there's an emphasis on it. People are looking at it and they want to make sure that they're accurately grabbing it.
Got it. You know, for the folks on here, we are going to send out this, and you will receive the PowerPoint. We apologize for the technical difficulties, but we certainly want to thank you, Jennifer, for an excellent presentation. And do you have any closing comments before we end the webinar?
I just want to thank you so much for having me. I think of all my areas that are hosting the World Cup, Dallas is probably in the best shape in terms of collectability because you are hosting countries that are highly, highly collectible, and the people coming are highly, highly affluent. So if you get the right things in place, there should be no reason you shouldn't be able to collect on a majority of these charges.
Thank you very much. This concludes our webinar, but thanks to each of you and everyone that registered will get a copy of Jennifer's PowerPoint. And again, we do apologize for the technical difficulty. Everyone, please have a good afternoon.